Hi there, I'm Dr. Mirissa D Price. I'm a pediatric dental resident at Boston Children's Hospital and a dentist trained at Harvard School of Dental Medicine. And I'm here today after being in the emergency department until about 2 a.m., helping the most adorable little girl get home in time for Santa, to talk to you about that dreaded F word, flossing. I know. Your dentist tells you about flossing all the time. Every single time you go, you can see that F word forming on their lips and you just zone out because you've heard it. We all know flossing is supposedly good for us, but it's just one of those things that we don't have time to add to our schedule, or we just don't think about at the end of a busy day. You're tired, there's TV to watch, there's assignments to do, there are kids to get to bed, and you just don't have the time to floss. And you know that your dentist is right, that maybe we should be adding flossing. I know that I should add a little bit more flossing into my life. But, it's just one of those things that falls by the wayside. If we're brushing our teeth, how much harm can come from flossing? Now, I work with kids, so I like to use creative analogies in my day-to-day life and my storytelling. Imagine you took your hand and you stuck that hand in a bowl of mashed potatoes, appropriate to the holiday season. Or maybe if you have a sweet tooth, you stick it in a bowl of cookie dough. So you stick that hand in that bowl of mashed potatoes or cookie dough and you pull your hand out. Now when you pull your hand out, at some point in the day, you're going to wash your hand and you scrub the front of it, you scrub the back of it. Just like you brush the front of your teeth, you brush the back of your teeth. And some of that water does slip through in between your fingers, so it cleans some of the particles of mashed potato or cookie dough that's between your fingers. But for the most part, you're leaving globs and globs of cookie dough in between your fingers. Ew. And then later in the day, you do it again. This time, we're at dinner, and we stick our hand in a bowl of gravy. We pull that hand out. We stick it in a bowl of Jell-O. We pull that hand out. And down the road, of course, again, throughout the day, saliva, water, different things can help rinse some of those particles away, but we're just washing the front of the hand. We're just washing the back of the hand. We're not washing in between the fingers, and we're leaving all of that food that we've had all through the day stuck between our fingers. Eventually, it would start to smell. It would start to feel uncomfortable, and your hand would start to really be irritated. Oh, excuse me. Like I said, I'm the dentist on call, so sometimes things do interrupt my podcasts. So, we have that hand filled with particles in between. It's disgusting. You wouldn't shake someone's hand if it looked like that. Very much the same. You don't want your teeth to look like that. Now, another analogy I like to use with some of the older kids, and bear with me, this is really gross, is crackers. Take a piece of floss and rub it between your teeth. Do the floss dance. Hug one tooth with it, then hug the other tooth with it because it's very lonely and it wants the same hug. And pull out that piece of floss. Whatever little particle of food is on it, wipe that on a cracker. Sometimes I carry that cracker in my scrub pocket so that I can show kids this in clinic. So you pull that out, you wipe that food on that cracker, and then offer that cracker to yourself, your loved one. Offer that cracker as something to eat. Nobody wants to eat that cracker. But when we leave food between our teeth all day long, we are eating that cracker. We're adding the food that's been sitting there for days to the food that we're swallowing at every single meal. And that's just not sanitary. It doesn't taste very good. And it just, all in all, sounds like a bad idea, right? So that's where flossing comes into play. That's why dentists preach flossing so heavily. Now, I know there's no literature to support flossing. You read that New York Times article that came out a while back that said there's no evidence in support of flossing, that we as dentists are making it up. This is big floss in combat with your wallet, trying to get you to, spend that extra dollar on floss so that you can have clean teeth. But really, there's no literature on flossing. There's no clinical studies on flossing because we know it has benefits. We know it's healthy for you. And my dog's about to bark because he just dropped his toy, so give me a minute. But we know it has benefits for you. In fact, we see it in clinic every day. Those patients who don't floss end up with cavities in between their teeth. Those patients who don't floss end up with gum disease as their gums are coping with this bacterial overload and this debris that's left there in between their teeth. Those patients that aren't flossing are ending up with bad breath because they have so much left over after every meal, again, sitting in between their teeth and those surfaces that just aren't accessed efficiently by a toothbrush. It wouldn't be appropriate for us, knowing the benefits of flossing, to do a study where we tell a group of people not to floss. Now, there are enough people in the world who aren't flossing that we do, have anecdotal evidence. But there's just not going to be a study out there that tells you definitively flossing is good, flossing is bad. But between you and me, there are so many benefits to flossing. Like I said, you can have better breath, you can have better gum health, you can prevent yourself from getting those cavities between your teeth that require obnoxious fillings where you're sitting at the dentist with your mouth open, and the dentist saying, open bigger, and asking you all these questions that you can't answer because they have a suction in your mouth. We can avoid all of that with a little bit of flossing. Again, I work with families. A lot of the families have children with special health care needs. A lot of the families have multiple children, and many of those children have special health care needs in some instances. So these are busy, they have busy lives. I don't expect them to floss every child's tooth every single day. I don't expect the parents to necessarily prioritize flossing their own teeth over doing the other daily chores that they have to get done to make their family's lives function easier. I don't even expect a single person who has a dog to floss every single day, because guess what happens when you go to reach for that floss? The dog thinks it's a toy and wants to play. And then perhaps it's time for Joey and I to go on a walk before I sit down to write an article for Colgate and do a little bit of research in teledentistry for my research project, and then before I know it, have to go to bed so that I can make it to rounds on time. I don't expect in a busy day like that for everyone to floss every single day. But what I do think we can do, and especially around this New Year's time when we're setting resolutions, is set a goal. Let's start flossing 3 days a week. My apologies, Joey dropped his toy. Let's start flossing 3 days a week. For me, picking weekdays is easier because I already have a routine. Building something new into my routine is more natural. So for me, let's do Monday, Wednesday, Thursday. For you, it might be weekends that are easier. So Saturday, Sunday, Monday. Or Friday, Saturday, Sunday. But whatever those days are, write them down. That is your intention. You are going to floss those 3 days every single week. Before you know it, what I've found personally is that you miss flossing on the days that you didn't intend to floss. And then you start adding flossing. It starts sneaking into your life until before you know it, you're flossing every single day, maybe multiple times a day. Maybe you're bringing a floss stick to work so that you can floss after lunch. Who knows? Crazier things can happen. But let's set that intention of 3 days a week. And let's see what that does for our dental health. Now, I'm not here to tell you that you're bad if you don't floss. That's not my job. I'm just here because I want to help you build a lifetime of healthy smiles. And I think this is the simplest thing that we can do to build those smiles. Some other simple things we can do is probably end this video so that I can play with Joey because he is not having it at this point. But this is Dr. Mirissa Price, encouraging you to floss as one of your many New Year's resolutions and wishing you a happy and healthy holiday season. Here's to many healthy smiles for the days to come. Now, time to play with Joey before I'm paged back into the emergency department. Bye.